Car collisions are the number one cause of injury in teens.
Absolutely, hands down, the most common reason is distracted driving.
We see motor vehicle accident victims every day, and many of them are young people. I saw 2 teens yesterday.
It's certainly something we see every day.
We see a lot of distracted drivers that you think if they just were paying attention, weren't distracted, they would never be here.
Just distracted driving as far as talking to your friends and, talking on the phone, texting. I would say just about every accident that a teenager is involved in, it's one of those reasons.
They immobilize them completely. They put a collar around their neck, a stiff collar.
Typically come in on a backboard.
Basically, they're tied down so they can't move at all.
There'll be a trauma team here to greet them.
X-ray, CT ready to go.
Put lines in them for intravenous fluids and medications.
Big lines, big 18 gauge needles in them.
Tubes to help them urinate. We'll put tubes in their chest, tubes in their stomach to drain blood collections.
We need to maintain their airway first and foremost, so we're putting tubes in their nose or down their throat to make sure that we're maintaining their airway.
Respiratory therapists, pharmacy, a number of nurses, technicians, doctors, all in the room.
Drawing blood, preparing to do blood transfusions if we need to.
They're terrified. They've just been in a very traumatic event, and then they have all these people around them, all, coming down on them all at once, and it can be very, very scary.
Bruises and strains, especially the neck and the chest.
Burns, abrasions.
Broken ribs, the chest is involved, the belly's involved.
Broken backs.
Head trauma, neck trauma, chest trauma, abdominal and pelvic trauma.
Pretty awful ankle, knee injuries.
They can lacerate their spleen, their liver.
People break legs.
Their brain then slams up against the inside of their skull and causing bleeding in the brain.
Some spinal injuries that are just devastating.
They hit the steering wheel going 60 miles an hour. Their organs then hit the inside of their chest wall.
Their organs are basically ripped away from the blood supply, and people just bleed internally.
They can die, they can bleed to death in a matter of seconds.
There's things we do medically that might be challenging, but there's nothing tougher than having to go in and tell a parent that their child has passed away.
I've only really gotten upset at work twice, and both of those instances were consoling parents.
That's not anything a parent is ever prepared to hear.
I cannot even imagine having to go through that.
Nobody ever thinks that their children are going to die first, so that's tough.
People going into shock when they hear this news, and crying my baby and how am I going to live, and it's really hard,
But the level of emotional trauma is such that they're often needing to be medicated and the like because their world has just been rocked.
After we've done our job and this person's stable, they still have their injuries that they have to live with for the rest of their lives. One minute they're having the time of their lives with all their friends, and one little mistake can change their lives forever. They'll have to live with it forever, whether they were responsible for an injury to themselves or to one of their friends or some kid crossing the street, or they are affected for the rest of their lives.